Is this on his channel?
Oh, okay. Hi, I'm John Wood. I'm a licensed massage therapist in Portland, Oregon, and my specialty is manual therapy. Actually, very specifically, just range of motion work, where the work that I do increases your range of motion, releases tension in the muscles very specifically, and allows those muscle fibers to start moving in symmetry with the fibers around them. Now, when I say that, you might be confused as to what I'm talking about. When you have an injury or repetitive stress where a muscle does the same thing all the time, it begins to start locking into that movement pattern. And as it does so, it actually squeezes out whatever liquids are within that, and as they become tighter and tighter, what's left is this mucousy substance that actually creates almost like an Elmer's glue type of approach. And what happens is those fibers now are locked together, and no exercise and no stretching can actually release those fibers because they are locked. And so what I do is I use a pressure therapy type of approach where when I find these locked fibers, and they will be very specific as far as the sensation that you get from those fibers. If I'm pressing on a set of fibers that are moving just fine, all you'll feel from me, or you'll feel in yourself, is I'm just poking this area here. Nothing, no pain, nothing really too intense. But if I find an area that has these locked fibers, they're not able to move out of the way, and they're going to scream at you for pressing on them. And I call that I'm going to be working with adhesions throughout the body, and as these adhesions form in the muscles, it limits the muscle's range of motion. And these fibers don't necessarily adheres throughout the entire muscle body itself, or the belly, or even at the attachment points. Basically, these areas are specific to maybe the movement that you're doing that created that. Everybody does different things, but the truth of the matter is adhesions are always formed when you have an injury or repetitive stress. So we're going to find some adhesions in Kim here, and she's worked with me once before. She's very intuitive, but this work can be done for people who just aren't that much in touch with their body if you follow these specific guidelines that I talk about. So today we're going to be working on the upper body and the shoulders and neck. And that's in relation to the other parts of the body, the lower back, hips, and upper legs. And I'll be doing a session also on the lower legs and the lower arms, because those are very specific. We use those so much more than we realize it, especially thinking about being on a computer all the time, or driving all the time. We're moving these forearms an awful lot, and the same thing when we're walking. It's the lower legs that get an awful lot of work, and so we'll be working on those at some other point. So today what I want to do is just begin with kind of explaining that even though Kim has some pains in certain areas, we'll be dealing with those, but we'll also be dealing with probably the cause of where that pain is coming from. And if you're confused about that, the truth is most areas of pain are not the problem. It's something else that has caused that pain. And usually it's a restriction in some part of a muscle that's close to that area. And as it restricts, then the body starts to adjust by using some other muscles to do that work. And as it gains that, well, I guess more than anything, as it starts to accumulate more movement in some of these other areas that are moving more specifically than the area that's restricted, then these start to work a little bit less specifically the way they were meant to. So as these muscles adjust to the lack of movement in certain areas, they begin to move more differently. And as that happens, it accumulates and it slides up into the area of pain. So more often than not, you have a chain of movement patterns that are causing that pain that she's finally feeling. I hope that's specific enough. If not, you can always contact me and we can talk a little bit more about that. So let's start today with, she's got some, is it this shoulder here that you've got some problems going on with? Okay, and the pain where you feel it specifically is right in there?
I can feel
Right in through there? Okay, that feels like it's a deltoid problem, and it could very well be because you have some limitations in another muscle, and it's the antagonist that's generally the problem where you feel the pain. It's the opposing muscle in that joint, and that's one of the things that the basis of everything that I do is that wherever the pain is at, I always go to the antagonist or the opposing muscle in that joint, and I generally will find a dysfunction in there that maybe and probably is part of the cause of where the pain is at. So we'll just start with this one here. And the work that I do is fairly specific, and you have to be willing to endure a little bit of discomfort through this. And I'll explain as I go here. As I said, when I press on certain areas, if she doesn't feel any real sharpness in that pressure, then I'm not all that worried that that muscle is dysfunctional. It actually is moving fine, because as I press, she'll just feel a little bit of pressure. But when I find the area that's dysfunctional and the opposing area, what she's going to find as I press, have any sharpness in this area here? Right down here. I'm feeling something right there. Okay. So what I do is I pin this area, and then I have her contract the muscle. And what happens is, as I press on that area and she contracts the muscle, the fibers start to, even though they don't want to, they start to contract. They start to reconnect with the nerve root that is innervating them. And so what I'm going to have her do is to do a little bit of contraction, and this middle deltoid abducts exactly like that. Oops, I felt it slip underneath there. Is it there, right there? Okay. Now, I want you to turn. There it is right there, okay? And all you need to do is you need to find this area, and you need to find the movement that increases that sharpness. That means that that area is most restricted in that movement, or else it wouldn't scream so much. Very simple stuff. You just follow where the problem's at. And you can see what she's doing right there. She's going into it. She's holding it for a couple of seconds. It increases that sharpness, which is another thing. If the sharpness does not increase, then you're not doing the contraction for those fibers are capable of doing. If the muscle doesn't contract, it's not going to hurt anymore. But if we find the spot that is supposed to contract and is not doing it, I'm feeling it start to loosen up, isn't it?
Yeah.
So what happens is you do this great slow pulsing action here where she's going into it, holding it for a little bit. Let me pin it a little bit more right there since it's moving. How about that? That increase it a little bit?
No, I think it's...
Okay, let's go down a little bit. Okay. How about in there? That feels like that's moving pretty good.
Yeah, you might have already gotten it, I don't know.
And it's very possible that it released. And what happens is, as you do that, you're going to notice, and she noticed initially that as she did that same movement, the sharpness increased to the same amount as she got to end point. But after she was doing it for a while, she noticed that the sharpness decreased at end point when that muscle started to move again. And now as a therapist, if you're a therapist, you're feeling this muscle begin to awaken and finally start moving the way it's supposed to. And as for her, she's more feeling that the increase in sharpness is less and less once it starts to decrease. Now, I don't always try to have them, especially immediately, get rid of that pain, because it's been a while that has formed over a long period of time, and so it will take a little while for it to release. So what I do is I generally say, you know, let's get that sharpness down about 20%, maybe 25%. And this is an area, if you are capable of pressing on it and you can handle the discomfort, it will relieve it like nothing else that I've experienced. Okay. Now, one of the things, though, I want to mention, if you're going to be doing this yourself, and I generally use a specific tool, even though I like to use my hands. I've been doing this for 15 years, and if I did everything with my hands, they would probably be gnarled up by this point. So I use a pressure tool, and I've learned to, with this pressure tool, to be able to feel that muscle engage as it begins to waken up again. And that's just something that comes with time. And right now I'll be using my fingers a little bit. And my point being is that if you find an area that's really, really painful to press on, and you can't do any movement because it just makes it scream, I would suggest is to use a tool or use your thumb and just put pressure on that area until you feel that sharpness increase, and then just hold it there. Breathe normally, send it good thoughts, and at some point you're going to notice that that sharpness goes down. Now, why don't I just do that rather than movement? It's because as that sharpness goes down, if you don't move that muscle, you're not retraining it how to contract the way it was meant to do. Now, you can do it with just pressure and it will relax, but you're not retraining it how to contract the way it was meant to do before it got locked into an adhesion. Okay, so when we're done with that, I'm going to be putting a little bit of this Oregon cream on it, and I'll show you the label. It's something that I make myself, and it's one of the most amazing soft tissue rehabilitative formulas that I've ever come across, and that's why I chose to make it myself. Right there. Okay, thanks, Dave. We have David here, who's Kimberly's husband, and he's showing you the jar of Oregon cream. And you can purchase that individually, but as I said, why I use it is it has the ability to keep those tissues that you release in here, keep them nice and soft so that they'll remain that way as you stretch it and for hours afterwards. Now, any work that I do here, I want you to know that as we begin these releases, that's just not the end of the whole thing. That area, if you don't continue to check it out and each day just find out if there is any more in there, it's going to start going back to where it was. It was familiar with being an adhesion, and until we retrain it how to be a moving muscle again, it's going to want to lock it back down. That's why this work is something, it's kind of a lifestyle change to a certain extent. It's checking in on your body all the time to find out where these spots are, leaving that problem, stretching it, getting it to move correctly, strengthening it, especially afterwards. But for the most part, our approach today is just going to be the releases and the stretches. Okay, and as I said, if you're just putting pressure on it, wait for it to release. At some point, you're going to notice that it's much less sensitive, and then you can start doing the movements. And even though that will increase the sharpness, it will still be dealable, I guess is what you might say. You can handle it. And what I do find with almost all my patients, in fact, pretty much to a person, is when we've been doing this for a while, they actually enjoy that pain. It's as if it's a good pain, not like the injury or the chronic problem that's caused a pain that's pretty much uncontrollable. This is a controlled sharpness or sting or nerve response where the nerve is finally reconnecting with those fibers, and those fibers now are capable of doing what the nerve is asking it to do, is contract and to stretch. And that's pretty much the beginning of this and the ending of what I'm going to be talking about specifically there, but you'll notice that I can't stop talking sometimes. So we're going to go into this and we're going to do some work, and I'll probably talk as I go. All right, so you felt that release in that, and you did your stretch. That was awesome. Now, just to give you an idea, stretches or contractions are a certain movement, and stretches are almost exactly 180 degrees diametrically opposed movement. So wherever you're doing the contraction, you're going the other way. So she did this way, and so she's turning it this way and moving it this way. Okay? And we'll be doing that as we go. So what I also wanted to say is that she has some pain in here, but if you have pain in the back or the upper shoulders in here, you want to address that, no question about it, because these areas up here have created, had adhesions created not because they're too tight and contracting too hard, they're actually created because they are overstretched. And that means that the opposing muscle in that joint is overly contracted. And I find more often than not that this area right through here, if you'll notice that her shoulder's a little bit medially rotated, a little bit this way, that puts a constant stretch on these muscles back here, and as you stretch a muscle, you weaken it. And if it stays stretched over a long period of time, it's going to kind of complain that it can't do any contraction, and that's where you're going to feel the pain. But the cause of that muscle is his opposing muscle. It's the antagonist on her body, which are primarily the pectorals, the serratus anterior, and there's a muscle that's on the front side of her scapula called the subscapularis. That is a muscle that rolls everything in. So as you can see from her shoulders a little bit medially rotated, it's probable that there are some adhesions in this area. I'm feeling something right in here. And as I press, feeling a little bit of sharpness in there, okay? Sometimes it takes a while for these muscles to respond, and so as I press, initially you may not feel anything. Maintain that pressure for a while, and notice that sometimes that pain cycle will ramp up from nothing to all. You realize, yep, there's an area there that's stained. That's an adhesion. So, again, I just find the spot, I put some pressure on it. Tell me where I'm right at the most, just go ahead and relax. We're at the most intense spot. You have to move up a little bit, or I'm feeling I'm right on it about there.
Yeah.
Is that it? Okay. So what I'm going to have her do is I'm going to have her do the same oscillating motion. This time she's going to reach across her body, because that's what this fiber does. Where do you feel the most sharpness as you reach? Right in there. A little bit more there. Right in there. Press down into me. There it is, right there. Okay, good. And then relax. Okay, good. So what I'm going to have her do is, this actually released fairly quickly. She has some adhesions that aren't highly formed, and oftentimes those adhesions will release really quickly. The ones that have been there for a while will take a little bit of that oscillating movement to be able to release it. So let's find something a little bit more, but here, to give you kind of an idea, what I use is kind of a generalized pattern as to how you move that arm to engage that muscle wherever you're at. And I start with a point on the shoulder, and wherever you have that adhesion, either in the pectorals or down here in her serratus, a little bit in there. Okay. Wherever you have that, you make an imaginary line between the point in the shoulder, right here, same point all the time, and where you are pressing on her body. And what you do is, that's the imaginary line that you push your arm through. And I suggest that you always push with the heel of your hand. That engages it more specifically. Now if you come down a little bit right there, that feels like that's it right there. And then relax. And then push again. Hold it for a couple of seconds. And I'm just maintaining the same pressure on here, and she's doing the work. She can push as hard or as little as she wants to, depending upon how much discomfort she wants to endure to begin with. But she's going to notice here shortly, and I almost felt like it released a little bit there. Do that one more time. It's starting to move a little bit more, and then relax it, okay? And then again, and tell me when that becomes less sharp. It feels like it's already starting to.
Yeah, that's
good.
Sharp.
Okay, so what happens is, there we go, and do that even more. Just push down with, there we go, right into it. Excellent. And relax. Okay, and as I said, she can press as little or as much as she wants, depending upon how much she wants to deal with. She's a pretty tough lady, so she wants to go into it a little bit more intently, but that also will possibly release it a little bit quicker. You just kind of have to feel with, if you're a therapist with your patient, or if you're by yourself, you just become more intuitive as you work with your body. Okay, so when we're done with that, because her arm is actually on the table and she can't reach behind her to give this a good stretch, what I do is, yes, it's what she's doing is called pin and stretch. We're just pinning that area that we just released, and she's stretching it, and because I'm pinning it, I'm shortening enough so that she doesn't have to reach quite so far to stretch it. Pretty simple stuff. How's that feel?
Feels really good.
Good. And she may have some other areas down in this area that she'll need to release. And again, you're just focusing on the movement pattern. If I have something down through here, and I press on that and she finds an adhesion that's going on there, then she's going to reach across her body pretty much to that, yep, set right through there. And you work around until you find that sharpness. The sharpness that is most intense. That's the movement that's most restricted. As I said, this is pretty simple stuff when it comes down to it, but you have to be willing to understand how the body moves, understand that not only where the pain is at, there's an opposing problem, and generally more than one opposing problem, but we'll just simplify it a little bit right now.
But sometimes when I'm doing that, then the part that's the most painful could be the stretch. If I'm just moving it around and finding where it's the most painful.
So here's the other part of this, and this is kind of fascinating. You can actually create that sharpness in that muscle if you pin it and stretch it to begin with, not pin it and contract it. But here's the conundrum, is that when you pin and stretch a muscle, if it's not capable of stretching like that, you micro tear a lot of those little fibers as you're stretching it underneath that pressure. But if you're pressing on it and you contract the muscle and you bring those fibers together, the potential of them tearing is so much less that you don't have to have the area heal before it starts getting better, which is primarily what will happen if you pin it, stretch it, and relax it, stretch it and relax it. It will start feeling a little bit better, but still kind of sensitive because those fibers are now torn. So, as I said, I truly suggest that you do the contractions. And then when you're done, stretch it so that the fibers that have started, that started like this and are starting to move, now we begin to teach them that they're capable of getting longer and increasing that range of motion. Okay. So I generally work on the muscles attached to the shoulder first, because when it comes to working with the shoulders and neck, because all the muscles on the neck are very dependent upon the muscles in the shoulder moving correctly. So I address the muscle fibers around the shoulder and upper chest and back before I get to the neck. Even if there's something going on up there, more likely, if it's very painful, go ahead and do a little of work in that area. But begin with the shoulders, just like in the previous video that we did. I began by working on her pelvis and making sure that that pelvis was neutral and a nice platform for her upper body to sit on. Which comes to another point, is no matter how much you work on this area up here, if your hips or your legs are dysfunctional and not moving correctly, you can actually have functionally one leg shorter than the other because of tightness in certain joints. And so when that happens, the entire body basically is well, where was my point was we're focusing on making sure that every area of the body is moving correctly so that it can support every other area of the body that's on top of it or below it. Wherever you have a dysfunction, you're going to have stress on the areas above, below it, or to the side of it. And then we'll be working on her legs later on. But let's go ahead and finish with some work here on her shoulders. I'm having her actually lay this way to begin with because I wanted to show you basically what we're talking about with the antagonist. But what I'm going to do is I'm going to have her turn over, and we're going to work on some of the muscles of the upper back so that we can, you know, normalize their movement patterns. And that's becoming a kind of a catchphrase for me, is normalizing the movement patterns. That means getting rid of those adhesions that are limiting that range of motion in that muscle, getting them to start moving again in symmetry with the other fibers, and then your brain knows exactly what to do with them. Now, oftentimes people say, well, you have to retrain them. Yeah, mostly it's that retraining is because of the limitations in that muscle. But if you get rid of those limitations, I truly trust that the brain understands the movement pattern that's necessary and that it's capable of doing, and it allows that area to move the way it's supposed to. And when an area is moving the way it's supposed to without limitations, there is no pain. It cannot manifest because everything is working right. And another little point is that about 85 to 90% of the pain in our bodies is soft tissue related. The rest of it is possibly bone, visceral organs, or disease. But 85 to 90% is soft tissue, something you can actually deal with and handle yourself if you understand how to do it. Okay, let's go ahead and have you turn over. All right, so again, knowing how these muscles move is very important, but what I generally tell people is that if you don't know exactly how to move that muscle to increase the sharpness when you find an adhesion, is just press into it. In some way or another, you're going to get some contraction in that muscle. And for those of you who are therapists or understand the kinesiology and anatomy, this should be fairly simple. And for those who don't, access my videos. I'll be able to tell you specifically how to move certain areas as those videos will show you. Okay? All right, so now she has a little bit of rounded shoulders, so I'm thinking that she has a little bit, potentially some stretch in these areas here, as well as in what's called her paraspinals or erector spinae. These muscles are attached right down here at the pelvis and come up and attach to the occiput right up and through here. And so what we're going to do is we're going to see what's going on with some of these areas. I'm going to look for some adhesions. I'm going to come over to the other side here so that it'll be easier for you to see. And I'm just going to, basically, I'm going to start with a little bit of pressure with my thumbs. And as I go through this area on her left side, I'm moving around and pressing, and she's going to tell me if there's an area that feels sharp, like right in through there. Yeah. And this, I believe, is a paraspinal. We'll find that out by having her do a specific movement. There's generally two real movements in this area here. It's bringing the shoulder back like this towards that area, okay, and back down. Now I'm going to press on that, and I want you to do that. Just a second, wait. Tell me when I'm right on the sharpest spot. Yeah. Right there, okay. Bring it back, right towards that pressure point. Did that increase the sharpness?
Yeah, a little bit.
A little bit? Okay. Now, it's very possible, though, that if it only increases a little bit in sharpness, then it's really not necessarily the biggest problem. So I'm going to have her do the movement that the paraspinals do, and that's arching her back. So she's going to come back up like that.
Yeah.
Yeah. There it was. Okay. So as she comes up, and keep this in mind, when you're doing these movements, do it slowly. Sometimes it can be really sharp. There we go, and then hold it for a couple seconds, then back down again, and completely relax in between. I don't want you to hurry with this movement because we have to train that muscle not only to contract, come back up, hold it for 2 seconds, and then come back down. We need to teach it how to relax because it's been in a semi-contracted state for a long time, and it needs to learn how to relax as well as contract. Come back up again. Feels to me like that's starting to soften a little bit. How's that sharpness?
Not quite as sharp.
not quite as sharp, but still about, okay? So I'm just gonna have her keep doing it until she feels comfortable that we've got some obvious relief in here, some release in that muscle. Focus in on that when you're doing this contraction. There we go, good, right up into it. And then again. There we go, I can feel that muscle starting to move a little bit more.
Yeah.
And as you feel that movement, she's feeling less sharpness in that because the muscle is moving better, and this is what we want. Come up again. There we go. And back down. Now next time I want you to bring this left shoulder up too to see if there's any involvement with that. Does that increase that sharpness when you do it?
No.
No? Okay, so then she doesn't have to do the movement with her shoulder because it's not involved in that. There we go. How's that feeling?
Better.
Definitely, still stuff going on. Well, as I said, what's happened is because you have a little bit of forward movement in those shoulders, this area has been stretched for quite a while, and sometimes it will take a little bit for it to start to really want to engage again. But she'll notice when she's done here, the palpable release in that area is so noticeable, it was worth the discomfort to go through. Good, there we go. And bring it back a little bit to that side, there we go. As she moves around, she'll find a movement that really engages that. And as she finds it, the most intense sharpness right in there, and then back down again. Now she did a little bit different than some of my patients do, but she's very in tune with her body. So what she's doing is she's doing that contraction and she's moving around to find, there we go, there's a little bit of movement there. And moving around to find where it's restricted, and she's holding it in that position to let it release. Because our body doesn't just move in one plane, it moves in so many different planes. And so that's what she's doing. But I said, there we go. That really woke up.
Yeah, it's...
There it was, right there.
Yeah.
Excellent. Good job.
Whew.
I'll put a little cream on this. Now, as you can see, her movement was coming back this way, and because she's on the table, she's not going to be able to stretch it right away. This cream also keeps that area nice and flexible, so that when we do get to the stretch, she'll be able to feel that stretch in that area. That feels much better in through there.
Oh, yeah.
Yeah. Okay, let's find a couple more spots here. And as I said, we're not going to go through everything here, but we're going to try to cover all the different movements that you do when you find these adhesions to find out, you know, which areas need to be released a certain way and which need to be released another way. So I'm going to come up those paraspinals, and I'm going to go right across to your scapula. And right up where the levator scapula attaches, right up in here. Is there any sharpness in there? A little bit in there too. Well, the levator scapula is just, it's exactly, it says what it does. It elevates the scapula. It brings the scapula up towards the head. And what she does there is she's going to actually shrug a little bit of her shoulder towards that area. Oops, excuse me. To make sure that I'm right on that. Tell me when I'm right there.
Yep.
Yep, okay. Now go ahead and, yep, bring it right up into it, and then back down. You feel that sharpness increase?
Yeah.
Got to feel the sharpness increase, or else you're not doing the correct movement. Oop, there we go. That's moving a little bit underneath me there. Good. And I'm going to get down so that my body is not being stressed as I do this. Now go ahead. There we go. Good.
Oh, God.
Uh-huh. That's doing great. Now, go back down. As I said, sometimes you'll love this pain so much you'll want to hold it. Don't, okay? Don't hold it for too long, because we need to teach it to relax as well as contract. Boy, you pushed me out on that one. I'm going to go make sure that I'm right down in it. There we go. And you'll know you're on it because it's going to be sharp. And if it's not sharp, you're not on it. I think I just slipped off of it a little bit there. Okay, try to stay with it. Which means if I slip off of it, that means it's starting to move better, which means it'll be a little harder to pin it, but it's now moving so well. There we go, and then back down. Okay. Ah. How's that sharpness?
Way better.
Way better. Yeah, I felt that muscle move a little bit. Now there's a little bit of chippiness in there. It's that muscle is kind of been locked into that position for a while. And what happens oftentimes is if you rub it, you'll notice it almost feels like bone in between a bunch of tissue. And it's because those fibers are so stuck together that you've actually almost created a bony-like situation. There we go. A bony-like situation, and those need to be released. They need to be normalized, or else you're not going to have correct movement in that muscle again. All right, right up into it. There we go. Good. Oh. All right, so we're getting some release in that area. Now, again, like I said, we don't want to completely get rid of it as much as you'd like to right off the bat. This is going to make you have to come back and do it again. And at some point, you're going to notice that when you do this work, it's not going to hurt. So all you need to do from there on is to do some maintenance, some stretching of that area, do a little bit of exercise. But you'll notice from the exercise that it tightens it up, and it may have a tendency to lock back down a little bit. So you check it after your exercise to make sure that it's moving freely. Good. And notice what she just did as far as her movement. She was bringing her shoulder up this way to release it with the contraction, and now she's going to show you how to stretch it. It's very simple. Go the opposite direction. Bring it down like that, and voila, you have a nice little stretch. Now she can also move her head around a little bit if she weren't in this face cradle, but more often than not, as she presses down, she finds that area that feels like it's tight and stretching, and that's what you want to do, is find that area that feels like it's really connected with that area that you released, and it will feel like it releases. So you hold it for however long it takes for that area to just let go, and now there's less tension in that area, right?
Yeah.
Yep, good. Okay, good. Now, there are some other muscles involved with this, and actually I'll be doing more videos of this specifically in certain muscles of the rotator cuff especially, but I'll do a couple of them just to begin with right now. So because she has a forward-leaning shoulder, these muscles in back here, the rotator cuff muscles that help bring the shoulder back, are being overstretched. So what we need to do is we need to release those, because as they get overstretched, they begin to form adhesions to prevent themselves from stretching too much. And so those adhesions are just like the ones from a muscle that's contracted too much. It still has to be released the same way. Now I suggest that you do work on the front, because that's the cause, right? But since we're in this position right now, we're going to do some releases on some of these overstretched muscles. And then when I turn her back over, we're going to focus on the antagonist to these muscles, the muscles that roll her shoulder this way. These are rolling their shoulder that way. So let's go ahead and find out not only that, but kind of raising the arm behind her, and a number of different movements. So as I press into this area right in through here, tell me if you find some sharpness.
Oh, yeah.
Right in there. Okay. So this is teres minor here, and what this does is it helps her extend her hand behind her. So, yep, so you're going to lift up like that, and then back down. I'm actually going to begin using my pressure tool. And I've got a hand tool here that I use all the time also. I'm going to press on this area here, and I want you to tell me what's going on as we do this. Tell me, I'm right in it, okay. So what I want you to do is I want you to keep your arm close to your body and just raise it a little ways. Did that increase that sharpness?
A little bit.
A little bit? Okay, let's go into it. I want to make sure I'm still there. Now raise it a little bit. Okay, did that increase it? okay? And then back down again. And try to stay there. You're kind of kicking me out, so start slowly. There we go, right there. Good. And then back down again when you're ready.
Oh.
Okay, now just wait for a second here. So what happens sometimes when these areas get really messed up and dysfunctional, some of these pain receptors actually experience the pain sensation when she's relaxed. And that's not normal, but it's because a lot of stuff here is not normal anyway. And so what I'm doing is I'm going to just press on that area when it gets sharp, when she's at rest. Just relax for a second. And I'm just going to press on it. Hold on. Tell me when I'm right on that sharp spot.
Oh, yeah.
Okay. All right, is that too much? I'll back off.
No, it's fine.
Okay. And that's another thing. Make sure that that the patient is comfortable enough with what you're doing. And okay, so I'm just going to hold it. Tell me when it's less sharp. Some of these areas that have been locked down like that will take a while before they start to respond. As soon as that begins to feel less sharp, let me know. I'm feeling a little bit of movement in that it's releasing a little bit.
Yeah.
Okay. Now, has it gone down a little bit?
Yeah.
So what I'm going to do is I'm going to press a little deeper and bring that pain sensation back up to the original pain before it started coming down. Tell me when.
Yeah.
Right there.
Yeah.
Okay. Now I'm trying to normalize this pain sensation. So as I press in here, I want you to lift slightly with that arm. Okay. Okay. There we go. Does that increase that when you do that?
Yeah.
Okay. Okay. And then back down again. Is that a little less painful when I press on it now?
Yeah.
Okay. And then back down. I'm going to make sure that I'm on it. You always make sure to check in with your patient to make sure that you're still on that spot, because if she's doing the work and you're not on the spot, you're not getting anything done. There we go. Right there.
Oh, yeah.
Okay. And now, oh yes, nice. You're kicking it out. Now keep your arm close, and then at some point you're going to try to reach across your back, which is what that muscle really does, and then back down again. Okay. Yep. And as she's doing that, she's monitoring that pain level, and at some point as she does this movement, she's going to notice that the sharpness is not quite so intense. That means that muscle now is starting to move a little bit. Now, I want to assure everyone here that when you press on certain areas and you press deeply, unless you feel maybe a thump, 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 which would be an artery, or a really nervy sensation, you're not injuring any tissues in there, even if it's sharp. I've been doing this for about 15 years, and it's a lot of people say, wow, I'm surprised I didn't have any bruises. Well, we're not really causing damage to the muscle itself. We're actually just releasing it from its prison of being stuck together.
Do bruises cause damage to the muscle, or do they just create blood circulation?
Well, bruises, basically it's the capillaries that kind of explode a little bit in those areas. And honestly, bruises are rarely a part of this, but if they are, as long as they're not painful when you press on them, I wouldn't be too concerned about them. Some people do bruise more easily than others. I just suggest be more careful, or contact me about it. Okay, so how'd that feel? You got that better? And
Yeah.
that was, okay. So what she was doing was she was lifting up like this and reaching across, okay? So what she's going to do to stretch it is she's going to come down this way, there we go, and because this is at an angle here, I'm going to have her reach across a little bit there, and she will probably feel that a little bit more in through there, right? And that's where you feel the stretch. And again, what you're doing with the stretch, two things. You're stretching it and waiting for it to release. If it doesn't release, or another area in that muscle system doesn't release, or you notice something else that's popping up, that's hindering the stretch. And so if it's in the muscle, it's an adhesion probably. You go to the area that you feel is tight. If you press on it, odds are really good that you're going to find another adhesion. And then you do this work to release it. Pretty simple stuff. It's not like chasing the pain. It's chasing the sensitivities. It's chasing the restrictions that are built up in the body. And as you do certain movements, certain muscles are required to do a certain movement, and other muscles are required to help them. You find where those restrictions are because you have a painful movement or tightness, and you just go to those areas. Once you find the sharpness, it's the same approach. Very simple. Pin it, contract it, relax, contract, relax. At some point it'll feel better, and when you're done with that, put a little cream on it or nothing else, just stretch it afterwards, which is the opposing movement. Okay, so we're going to also work on a couple other areas down through here. As I said, one of the muscles that does it does affect the shoulder movement are these muscles down through here called your serratus anterior muscles. They're on the outside of the intercostals that are in between your ribs. And these muscles, all the ones down below your armpit, they push you down, okay? And if they're restricted, guess what you can't do as easily? You can't raise your arm, okay? And I find a lot of people, they go, well, when I raise my arm, it's really painful right up here. Well, it's because this is the muscle that's trying to do the work to raise your arm, but it's trying to fight a muscle that's so restricted that it will not stretch to allow that to happen. And where you find the injury is not in the area that's causing it, it's in the area that's trying to do the movement. It's what's fascinating about this work. And so, and more often than not, you won't notice that there's any problem down in this area unless you press on it. Highly contracted muscles will not cause you any pain unless you press on them, and then that's forcing them to stretch and they will scream at you, okay? So the area that's highly stretched will scream at you without even pressure, but you still do the same thing. Find the area that's painful, and then find the sharpness that's in that muscle, and that's where the adhesion's at. So we'll do a little bit of work down through here to try to release some of the adhesions in this serratus. There's a little bit right there. Okay, so as I pin it, we're going to use that procedure, starting with this area right there. That's where you want to start the imaginary line and go straight down her body. So if she were to reach for her feet, voila, and then relax. Was I right on it?
Yes.
Okay. Now I just keep pinning it, and she does her work, pushing through the heel of her hand. There we go. And then relax it. And then do that again. Don't get too impatient with this. Some of these areas can take a while, but once they get to releasing, boy, the feeling is, there we go. The feeling is amazing. I just felt that pop.
Yeah.
Start to feel better?
Yes.
Absolutely. Now that muscle is moving much more freely because that adhesion is much less restricted. Go ahead, do it again. Push even harder now. Just go down. You feel much sharpness in there? Mm-hmm. A little bit?
Yeah.
Okay. So what happens is when you go a certain distance, and when you're doing this and it gets better, you still may be restricted in further range of motion, so push a little deeper. Once it's released though, don't keep pushing deeper and deeper and maintaining that pain. Let your body feel the release. Let it feel that adhesions start to release a little bit, and then maintain pressure on that and have them move deeper into that range of motion to see if the deeper fibers are still restricted. We're kind of releasing it from superficial to deep as we do this work. Okay, how was that?
Yeah, it feels really good.
Good. And I'll put a little cream on that area there. And as I said, I'm giving her a short shrift on this because of our video. She deserves a lot more treatment here, and we'll be doing that at some other point. But what I'm doing here is just showing you how to do this work, because this can be done by yourself with a Theracane to get to a lot of different areas that you otherwise can't get to. Okay, and self-therapy is what I teach. All my patients, the key to this is not only getting them better, but to teach them how to stay better and how to do this work on any part of their body that there's a problem with. It's very simple stuff. Okay, all right, so now that we've done a little bit of work on this area here, there are some other areas to work on. You have this, the surface muscle on your scapula here is called the infraspinatus. And it can tend to be a little bit sensitive also, because it's just a thin muscle right on top of that bone. So when you're pressing on it, don't press too hard. You'll be pressing it against bone. But you can still find potentially an adhesion in that area there.
Yeah. Right
in there. And what's fascinating about the infraspinatus is it does a little bit different movement than the teres minor. It actually lifts the arm behind, and it turns your thumb laterally and towards the ceiling. So what I'm going to do is I'm going to pin this up, right there. Go ahead and lift up a little bit. Now turn your out and try to go all the way towards the ceiling. No, with that, there it is, right there. Feel how that engaged it? And back and down. I want to make sure I stay right on that. Okay. Turn up all the way. Try to turn it even further. There we go. See how that engaged there? You feeling that, Kim?
Yeah.
Awesome. She's focused in on this, so sometimes she's not focusing in on talking, but I can tell and she can feel this as it starts to waken up. How's that doing?
Good. I feel like you got a little bit off of the...
Okay. That's right there. Okay. And as I pin it, and then turn it up, there we go. Normal is actually being able to turn your thumb directly towards the ceiling. And you're just still a little bit limited there, so there might be some other adhesions. The other adhesions, there we go, on this infraspinatus that need to be released. There we go. How's that right there?
Oh, yeah.
Okay. Good. And turning it out. Go even a little bit further. There we go. Feel that engage. Nice. And then relax back down. Let's go ahead and do a couple more times, because it feels to me like you really, this is really a bothersome area potentially.
Yeah.
Yeah. And again, all part of, because her shoulders aren't quite neutral, this area has been overstretched for quite a while. And when that happens, when a muscle is overstretched, not only does it create adhesions, but when you make it do something that it can't do, normally because it's overstretched, it will lock up into more adhesions, and now you've got more adhesions to release. How's that doing now?
Much better.
Much better. Yep, it's moving much better there too. Good job. Now, her stretch on that will be very similar to before, but she's going to come forward and she's going to turn her thumb down because she was trying to turn her thumb up. The opposing muscle, she'll turn out like that, turn her thumb down and the other way, and she'll feel more of a stretch in this area here. And she's searching for it. And this is not actually the best way to find that stretch. I should actually have her sit up and we'll be able to do it this way, but right now, just making it as simple as possible and explaining it to you, you'll understand. Okay. now when those adhesions are, then not only will it stretch easier, but it will actually contract easier. Now those fibers are moving, they're going to join with their fellow fibers, and they're going to work together. And potentially, if you overdo it, they're going to start locking back up together. So that's why this is not just a one and done type of work. You want to make sure that you check on a regular basis. You don't have to do it every day, but once things are moving well, you can check once every couple, 3 days just to make sure. But if you do a lot of stressful work, you want to check it fairly regularly. Okay. All right. So now I'm going to do a little bit of work on the upper part of her trapezius right in through here, which is also where her paraspinals are attached. And as I press into this area here, again, we're looking for a sharpness. Not too bad there. See, this is another thing. I'm not just trying to hurt her, find spots that I can hurt her with. What's true is that there's a lot of places where I can press really deep and she's not feeling anything but a poke. That's why when you do find the areas of sharpness, how about right up in here? Yeah. She has a very high pain tolerance level, so sometimes I have to go a little bit deeper, and sometimes also it takes a bit for this area to wake up. So does it feel like that's waking up a little bit more? Yeah, so as I continue to press on it, that sharpness is starting to build, so we know we've got an adhesion right there. Okay, so your natural reaction would be, yeah, there we go, to be to stretch it underneath it, but yes, come back into it. There we go, and then come right towards it, turn the other way. I think if you turn this way and come towards it, you feel a little bit more right in there. Okay, so that's potentially stretching it a little bit underneath here. What I want you to do is, I want you to, when I pin it, right in, that's it, right there. Okay, just come straight back and turn this way and then veer towards it. Not so much?
Yeah.
A little bit? Okay. Find the movement that you feel is really contracting it and makes it sharp. Because you can stretch it underneath it, but it feels to me like you were right there a couple of times. Right up in there. Right there. Okay, and let's do that again. You feel like I'm on it? Mm-hmm. Okay. There we go. And then back down. Let's just try that movement for a while and let me know if that feels like that's starting to release. Ah. Huh. We just got a little bit better movement there. Mm-hmm. Yep. Good. There we go. Good. And as I said, she's pretty advanced with this. She's feeling this as she goes, knowing where it's at, and then again just holding it for a bit, and then releasing it back down again and relaxing completely. Is that starting to release a little bit for you?
Yeah.
But none of these areas will take a while. Like I said, if there's a lot more dysfunction than is normal, and I don't know what normal, I guess, dysfunction is, because everybody's got these. There we go. It feels like you're moving much more freely into it too.
Yeah,
it's pressing up against me a little bit more. Awesome. Now, notice what she did. And what we're going to do now is I'm actually going to turn her over onto her back, but I'm going to have her do a stretch for this before she does, because to do this stretch you have to go forward and to the right, because she went back and to the left to release it. So And we'll do, like I said, we'll do more on, do you have another area here that you really want me to focus on? On this side at all, or?
Yeah, but I mean,
okay.
They probably were a little equal, so just
yeah, let's do that. We've got time on this. All right, so I'm going to do a little bit of work here, but I think what we'll do is primarily we'll do a little bit of work here, and then I'm going to work up into her neck, and then when we're done here, I'm going to give her a good full equilibrium of work, basically, just to allow her shoulders to move more freely together. And so let's go ahead and go back into this area here where we started with the paraspinals on the right side of her spine. Right in there. And if there's no sharpness, you don't need to hang there. There's something going on right in through there.
Yep.
Okay. Is that sharpening up a bit?
A little bit.
Not too much. Let's go ahead and do it though. As you tilt back, you're going to bring that shoulder towards it. Up towards it. There we go. Up in. There we go. Right up into it. Feel how that contracted it. If there's no sharpness to that movement, she doesn't need to do it because it's not part of that movement pattern that's restricted.
Yeah, it's more
when you do that. Okay, so you'll be, and that's basically stretching your trapezius a little bit underneath this. So let's find out if there's more to that than just that movement. Am I right there? Yeah, I'm feeling some stuff right in through here.
Yeah.
Right there. All right, go ahead and tilt your head back and tilt it a little bit towards the right. Now, come actually this way, back. Yeah, right into there. Did that increase that?
Yeah.
Okay, and then back down again. And once you find the movement, you want to just kind of hang there with it for the most part, okay? Unless you're, again, you're adventurous when it comes to the body movements. You can do what she's doing in some of these situations. Just move around, find where it's most restricted, and then just hold it there a bit until it releases. There we go, good. It's starting to wake up a little bit. Feel like I'm still right there?
Yeah.
Okay. There we go. There it goes. Feel that muscle?
Yeah.
Yep, good. And that's released. Yeah, that feels like that's moving better already. Good. And as I said, you tend to get used to this because it's a sharpness or discomfort that you can control, and it directly affects the movement in that muscle. How are you doing?
Good.
All right, good. Okay, and we can find some more. As I said, I'm going to go up into our levator on this side and see if there's some things going on up into this muscle here, which one of our major shrugging muscles, levator and the trapezius right here. How about right up in, anything going on right there? Not too bad? Good.
Yeah,
It's starting to wake up, huh?
Mm-hmm.
Yeah. Okay. And then let's have you go ahead and shrug a little bit. There we go, right up into it. Good. Did that increase that sharpness?
Yeah.
Okay. You know you're doing the right movement if it hurts. But you don't hold it for too long generally. If it's really sharp, you want to hold it for a couple of seconds. Just get it to try to engage, and then relax it. Give it a chance to start understanding what you're trying to do to it. Good. Just right into it. And then back down. And again. Yeah, right there. Good. And I don't say that you can't hold it up there. I just think it's important that you give it a chance to relax in between. Just like she's doing right now, just letting it kind of, there we go. And that gives it a little bit more opportunity to really contract hard once it's completely relaxed. If you don't completely relax it, it won't be able to completely contract. There we go. There, that's moving much better there. And she's feeling a lot less pain in that area. Excellent. Okay. Good job. I appreciate you being the subject today with what we're doing.
I appreciate being the subject.
I'll bet. Like I said, the release is incredibly palpable. You'll notice the results right away. Now, one thing to remember is that once you've done this release, that muscle has been locked down for a long time. So what it's going to do for the next day or so is it's going to be sore, because it's almost like a workout soreness. If you haven't worked out for a week or so and you go back and you do the same kind of movements that you did before you stopped doing it, you're going to be paying for it for the next couple of days. Well, the soreness is not quite the same here. It does last maybe 24 to 30 hours, but afterwards the feeling, like I said, is palpably improved. And like I said, by that time you're ready to do some more work on it, to release it even more, until at some point when you press on that spot and you try to find sharpness, it's not there. And you do your movements, you go, gosh, I can freely move so much more easily than I did before. All right, so now that we've gotten some of this taken care of through here, I can actually work a little bit on the subscap and some of these muscles on when I turn you over. Let's have you go ahead and sit up, and let's have you do a stretch for these areas that we released. She's stretching that area right down up underneath here, and if she brings her shoulder forward a little bit, she's going to stretch right back in this area through here, this the teres minor. There we go. Doing great. How's that feel?
So good. Like,
Yep.
Yeah, that was tight.
Okay, and we'll work on some of that. I also am going to do a video of for the arms, primarily the lower arms, but upper arms also. And then when I turn her over now, we're going to work on some of the anterior muscles of the body. Okay. Good. Okay. So as I said, a lot of the problems with the pain in your upper back and even down into the lower back is caused by too much contraction in the anterior muscles through here, even the biceps, the serratus anterior aspect of your ribs. All these will contract, and they love to contract, whereas these muscles in back, they love to help out. And unfortunately, because they're helping out and these muscles start to get locked down, the helpers start to get overstretched, and those helpers need to be released. And again, the strengthening work, more often than not, I tell my patients that three areas to exercise primarily to balance out your body: the gluteals, the abdominals, and the back. Generally the upper back, but all the way down into the lower back. Those are the opposing muscles. Those are the overstretched muscles from the the chest, which is too contracted, the back, which is too contracted beyond the abdominals, and the front legs and your hip flexors, which are almost always too contracted, making those gluteals, which are the opposing muscles to your hip flexors, making those gluteals weaker. And besides, think about what we do with those gluteals all day long. If you're sitting at a desk, you're sitting on them and you're stretching them and you're making them weak. And then you try to get up and walk, you have back problem, potentially back problems, but you also engage the hamstrings more, because if the gluteals aren't doing their work, you've got to find something to walk, and so the hamstrings are involved. Plus, your lower back is involved with it. Wherever you don't have movement, the muscles on either side of that are going to be stressed out, and they're not capable of doing the movement of the area that's supposed to be moving. So, all right. So we've done some work on her shoulders, and I want to do more work on these pectoral areas in through here. Everywhere that you just press deeply and find a sharpness. You got something going on right in there? Is that ramping up a little bit?
Well, I mean,
not too bad?
Yes,
okay. So because we've got this point on her shoulder, and where we're at here, if she reaches right across her body, find the movement. Is that it right there?
Yeah, that's not that bad, but...
Not too bad? But let's release it if it's there. Okay, good. I felt that pop right away, so it felt like it was, yeah. Now, there's another area that's really difficult to get to, and generally I suggest that just the therapist do this for your patients, is the subscapularis, which is on the anterior aspect of your scapula. And that is one of the major rotator muscles for your shoulder, and it rolls those shoulders forward. Because of the tightness in that, it's pulling them forward, which stretches the back. So what I'm going to do is I'm just going to get into this area and find out if there are adhesions in this area. A little bit difficult to get to, but just go ahead and relax right here. Just drop your arm. Good. Deep breath. And exhale. And as I go in there, I just bring your shoulder this way, try to bring it down. And as I press into this area here, hold it for a bit. Do you have any sharpness in that area? Starting to wake up a little bit. Yeah. Tell me as I move around where it's most intense. It's pretty intense right there. Okay, so what the movement you want to do, you want to contract this muscle. So what you're going to do, actually put your thumb right down here on your belly button. And what you're going to do is you're going to raise your elbow towards the ceiling. There we go. And roll that shoulder towards your sternum, which is right in here. There we go. And then relax it. Good. And then when you're ready, do that again. There we go. Actually not too bad. I felt a little bit of movement in there. Hold it and then relax it. That again. There we go. Yep. Roll that and raise that elbow more. There we go. Feel how, yep, that engages that more. Good. And then relax. Okay. Let me know when that's feeling better. It's definitely moving better already. Lift. Now keep it right there. Just raise that elbow up. There we go. Right there. Don't reach across too much. Just keep it right on your belly button. There we go. And try to roll not towards your neck, but down this way, right in there. There we go. Okay? Let me know when, let's do this until you feel some good release there. Good. There we go. That's definitely moving better. Feel how you're contracting more and more muscle now that that's able to contract. It feels, one of the things you'll notice when this muscle starts to release, wherever you have your adhesions, you feel stronger. Why do you feel stronger? Because now you have more fibers working with the rest of those muscles. That's why I find this is incredibly effective to do before any kind of physical therapy. If you can get the muscles moving the way they're supposed to, physical therapy can be an absolute breeze. Things are working well. But conversely, if those adhesions aren't released, exercise or stretching, any kind of physical therapy will only be partially effective. Okay? Good. And then that stretch for this, very simple one, keeps her elbow into the side and then brings it down this way. There we go. And what you'll feel is a kind of a pressure underneath her shoulder blade. Now, if there is something that's in the way, which oftentimes is the bicep in here, this bicep and the deltoids, these are areas, as she was doing this stretch, she was noticing that this was starting to act up. So guess what? This is where we need to go next. So as I'm on that, I'm going to write on that.
Yeah.
Okay, so go ahead and abduct a little bit and then roll it, yeah, back and forth, and tell me right in there is where it feels like it's released. It needs to release. Am I right on that?
Yeah.
Good. I'm going to pin it right there and now do that. Is that it right there?
Yes.
Yeah. Good. And again, just slowly, just like she's doing that. What I generally do is I inhale on the relaxation part, and then as I do the work, I exhale. If you've lifted weights, you know what I'm talking about. You exhale on that push. It's the same thing here. We're just getting into that. Breathing deeply is good. You need oxygen for these releases. How's that feeling? It's moving much better underneath here. That's great. And you've already figured out the stretch, because we had that same problem on the other side, and you did the stretch perfectly. Okay. All right. Good, better. Good, better, best.
Yeah.
Good. Yeah. And turn a little bit, you know, as you go, and just kind of do this stretch. As you do that, you'll notice that a little bit different movement will find that area, and oh, there it is, and then you just kind of wait for it to release. Relax, enjoy it, give yourself some love. The work that you're doing is exactly what the body needs, and as I said, I don't know many people who do this work, and it's,
I don't know anyone.
yeah. So and having found this out, I have an associate, Ariana, that works with me. We do this kind of work, similar but different approaches, but same kind of approach. Basically, finding what people call a trigger point and making that muscle begin to contract so that it connects with your nerve root system, and as the nerves finally send the signal into those fibers, they can finally do what the signal wants them to, instead of being so stuck together that they can't move. And that's where we're at with a lot of the things that are happening in the body. Now, scoot back down a little bit so your head's not completely off the table there. Okay, now I'm going to work a little bit on the scalenes, which are a series of muscles, 3 of them on this side of the neck, and it does a number of different things. Most of them this way, and moving it this way. And again, just finding the sharpness. Let's find something here. Ooh, there's something right in there. Okay. And just try to pin it the best you can. Oftentimes when I can't pin something that's really thin, like this, what I'll do is either go behind it or go in front of it, depending upon how I'm going to move. If I go behind it on this one, because she's going to be turning this way and moving into me, I want you to turn that way and move into me. There we go. Right there. There it is. Is that it right there?
Yeah.
Perfect. She found it. This is, again, you're just searching, being adventurous, finding these movements. Now, not just that, I want you to slide your neck towards your shoulder and bring the shoulder towards your neck. Towards up. There we go. Feel how that increases that? Uh-huh. And it's a complete release for this area when you do that. And then again, bring it up. Go ahead and pin my fingers there. It's not hurting me now. There we go. Good. Feel like I'm still right on it? Okay. And now she's just running with it so that she can get that complete release between this muscle that's dependent upon the shoulder and how it helps her to move her neck and her range of motion. By releasing the muscles on the right, your range of motion to the left should be better. And just think about that if you're not absolutely sure what that means. Most therapists will understand. If these are so tight here, she can't turn to the left, so let's loosen them up, and voila, she turns much more easily to the left. And that's how she'll stretch it. Actually, she'll stretch it not only that way, but she's going to bring it up like that and bring her shoulder down to stretch those scalenes because she went down and to the right to contract it. She's going up and to the left, and now she's got more of a stretch. And she's going to feel it in some other areas too. Like I said, this uncovers so many restrictions and adhesions that you otherwise wouldn't even notice are there.
It's amazing. Oh.
Good. And then there's another area back in the back here. A lot of people have a lot of potentially headaches. I'd say about 90% of the headaches that most people get are trapezius related. That's the big muscle in behind here. I don't know if you can see up here. It's this muscle here that comes all the way up into here. And when it's super tight, what it does is it translates that tension up through the other muscles here, the temporalis, all the way up into the front of the skull, and the headaches is the end point. As I've said before, oftentimes the pain is not where the problem's at. It starts back here, and this is where she's feeling the pain. If you release this back in here, I'm not saying she has headaches, but if you do, release this through here and do your stretches, and you're going to notice that I think your headaches will dissipate a lot more easily, or maybe even go away. Okay, so as I get behind here into the edge of the trap, is there something going on right in through there? Okay, so the trapezius is part of a system of muscles just like the paraspinals. Just lifts it up like that and turns towards it, and then where you're there, push straight down into the table. There we go. Is that it right there? Was that the movement? Yep. Whatever increases that sharpness is the correct movement. Press down into there. Now, where your head is on the table, press straight down. There we go. Right there, and relax. Good. Keep that chin up because it helps tilt you back. There we go. And come into it as she's turning and pressing down into it. And then back. How's that doing? Starting to release? I feel it moving better in there. Let's go ahead one more time. Yep. Chin up a little bit. There we go. Nice. And relax. Okay. And what she's going to do now to stretch it is she's going to tilt forward, and she's going to turn this way, and tell me when it feels like we've got a stretch right on that area. We're going to kind of move it around here. And right about there it is. Okay. She feels it right where we were working. And then we're just waiting for it to release. And again, if she feels anything not releasing, that's probably another adhesion. And that's what we want to do, is to treat that. Now there's a number of other muscles around here that I can work on, and I will be doing in the future, very specific to some of the muscles in front here, your SCM. And again, all these muscles here in the pectorals are so much more involved in back pain than most people realize. Okay, and let's just do a little bit of work on her jaw here. We have her masseters here, which actually helps her crunch her teeth together. And so let's find out if there's anything going on here as I press. Any sharpness in any of these areas? A little bit in there? All right, so as I press on it, just go ahead and now clench your teeth together. There it is, right there. What you just did naturally was to stretch them.
Yeah,
okay, and
that's
okay.
I naturally do.
It is. I know a lot of people do. Now, like I said, I mean that's a way, but it's really not as effective by far. There we go, and then relax it. Good. Do that again. There we go. I feel the masseters start to wake up a little bit more. There we go. There, right underneath it. You're feeling better there? Yeah. It's probably still pretty sore.
Yeah.
Yeah. And then one more time. And then you just stretch it. What I do is I take, go ahead and relax for a second, keep it neutral. I take the bottom of the masseter and I pin it and I pull up and she opens her mouth. There's your stretch, right in through there. Feel that? Yeah. And now your jaw can move more easily. You have a few others, digastrics underneath here, a number of other areas that you can work on, but it makes such a difference. Okay? And I think that'll be it for today. Gosh, I had a great time working with you. I really appreciate this an awful lot. And like I said, we'll be doing more before you guys leave.